Some of the changes that we have seen over the past year include the transition to the medical home at the State Street HIV clinic. We are right now making sure that we become a real medical home by having all the services available for the patients in one site. One of the biggest successes that we have had in our clinic is working as a team.
Huddling is something that has been really helpful, and the providers were somewhat resistant to it at first, but in the morning, having just like, let's go over all the patients for the day really quickly, even if we don't get through all of the patients that day. But that's been really helpful in making sure that they are immune to hepatitis and all these kinds of things. So it's been beneficial, and even the providers are seeing that these days.
Now everyone kind of meets, expects it, and I believe that the patients also reap the benefits of that. It's a good basis to start building a care team to springboard into some of the other patient-centered medical home features.
I'm very happy to be here. I do have a very good team. We check in regularly, and we support each other. We all may have different units of service or different types of work to do, but we are all working in the same direction.
One of the effective ways of engaging the patient into their care and making sure the patient comes back to the clinic is the outreach that we do with our case managers. When we see that a patient hasn't been here for 3 to 6 months, we go out and we find the patient.
Implementing the registry and just keeping everyone mindful of the patients that aren't necessarily in the clinic, the patients who you haven't seen in 3-6 months, to try and bring them back in. And not just like clinical or outreach staff, but everyone, because everyone has a connection with a patient.
The patient just came in for a family planning visit, and she came in for just a med refill regarding that. She had been one of those that, even though I, in my own head, have realized that she hadn't been here for a while, so I had asked the provider to see if she can see the patient as a family planning visit just to get her through, but then also ask her if she's been up to date with her medications and everything, and it turned out that she actually wasn't, so we got her right back in care.
People who really have not been seen for a very long time will have a red labels on their names, so I'll know which ones are priority people I need to get a hold of, and then the other ones are more of just when I get to them. Because again, if you've been out of care, we operate on an MIA 3-month cycle. If we haven't seen you more than 3 months, medical and psychosocial and case managers, then that's an alert for me to capture these individuals.
And in this clinic, particularly because of all the services that we offer and how much support we give to the patients to get to their health goals, I think is most rewarding in this clinic because we see the changes.
Our providers really care, they really try, and we offer a range of services from the food pantry, case management, transportation services, things like that. But really, I'd say the culture, we all work together and we all share the same common language, even though we all may be different. Come to Tri-City because it is a real medical home.